Before starting the presentation, I would acknowledge there is one biggest doctor in the world. You know who is? Google. Dr. Google. I have seen millions of presentations where Google has contributed without putting any acknowledgement for Google. And lot of pictures, research, and credentials, publications, everything is available on Google. And after nature, I would say Dr. Google is the main one who is guiding. But you know, Google has also made us paralyzed, that no one wants to think innovative, no one wants to think different, no one wants to really see what would be the good for mankind. Why wellness? There are so many issues, that new and new issues are creeping up. My presentation, of course, there is a time limit, but my presentations were liked by WHO, UNICEF, UNESCO, and I was awarded Encyclopedia of Medical Nutrition, none other than Dr. APJ Kalam. And he has introduced me to various ICMR scientific panels. So this presentation would find you research and development, regulatory, as well as some medical aspects of treating chronic degenerative diseases. Like today we say cancer, diabetes, metabolic syndrome, neurodegeneration, Alzheimer's, Parkinson's, stroke, multiple sclerosis, all this kind of stuff, from where they have arrived, where 50 years back, none of them were existing. What drastic changes we really did to ourselves, and more we drifted, more we shifted from nature, more are the problems we have created. Plants, they don't speak, they murmur, they whisper. Scientists go close to the plants and understand the language and transform into the medical research for the benefit of millions and billions of people. Here the presentation will start with this good note. Now here, of course, some presentations were talked about clinical claims. A lot of people want to make the clinical trials, clinical studies to make the claims, but in the product, whatever in the trial they have used, that concentration is missing. For example, coenzyme Q10 for chronic heart failure, clinical trials are of 300 milligram, and you get market samples with 5 milligram of CoQ10. Is it justifiable? No. So exact concentration, dosage is important, what has gone to the clinical trials, and none of the health claims are approved by FDA, Food, Drug and Administration. In fact, they say that all these nutritional medicines not intend to cure, treat or diagnose any particular disease or disorder. Now there I contradict, I have made lot of presentations, representation to WHO. If that is so, why the disease called malnutrition? If nutrition has no health claims, from where this malnutrition has come, where 48% children below 5 years in India are dying every year. So the disease called malnutrition, so nutrition has to be therapeutic. It is no longer preventive. Now, as per World Health Organization says, 80% of all the medicines, they use natural products. There are natural products used worldwide. It is not the scenario in India. That will be reflected. Of course, I cannot go each and every word, but you know, let me tell you that today global Ayurveda, not natural products. I will not only say Ayurveda, because whatever is close to nature or nature identical. I will not say natural word also, because natural and healthy, these are the two culprits. FDA has said they are all fake. There is no healthy, there is no natural. So the nature identical, more close to nature, this type of products, whatever are there, the business is 6,70,000 crores. And out of that, US is dominating 41%, Europe is 21%, China 13%, and India accounts for only 2.5%. Isn't it unfortunate thing? 3,000-year-old Ayurveda, what we established. There are 50,000 medicinal plants that I have personally studied. You can come to me, I can count 1, 2, 3, 4 like that, 50,000 medicinal plants and their enormous benefits on medicinal. And Ayush department has got 43,000 formulations registered in Ayush, only 1,500 we have commercialized. That means we search for something else, something synergy somewhere else, whereas 43,000 formulations are in-house available with Ayush, and only 1,500 are commercialized. Now, if you say, unfortunately, the research, what has happened? on our traditional Ayurveda herbs in Western world is enormous. Now, 8,484 research papers published in Ayurveda clinical role in cancer prevention itself, and they are going in for cancer prevention approved by US Department of Health, National Institute of Health, NIH, like ginger, tulsi, turmeric. All these are going in actually the prevention and treatment of cancer. And there are a lot of studies like this on curcumin, on turmeric, on soft, on cumin. There are these number of studies, clinical studies, which are established. And on the top of that, US Department of Health and National Institute of Health. Of course, these are various herbs which go in chronic treatment. For example, if you say the varicose veins, or liver you say dandelion. And dandelion, here I would say that chronic liver cirrhosis, or you can say liver hormones, like these hormonal imbalance also is corrected by these herbs, and these are clinically researched, and there are a lot of publications already available. Only thing, dosage, concentration, and purity, these are the key factors while using all this, and these are the ingredients mainly used in your wellness, spa, and various other therapies also. Garlic, I don't have to say anything about it. Garlic has already proven its clinical role, and it has entered in pharmacopoeia also, in pharmaceutical medicine, in herbal medicine, in nutrition, everywhere garlic, treating hypertension, then blood pressure, then cerebrovascular ischemia, what we say normally, and also some types of cancers. Now, garlic has selenium and methionine. These are the two. Everyone knows about allicin. But garlic has got selenium, which is a very powerful antioxidant which works against cancer. And methionine is very useful amino acid, which is normally given for chronic kidney patients. Now mind you, kidney patients, they cannot digest proteins. So it is a wrong practice that those who have 3rd grade or 4th grade chronic kidney disease, normally proteins of a concentrated source should not be prescribed, because their glomerular filtration rate drastically reduces and creatinine is increased, So there is a dual correction factor needed with respect to chronic kidney failure patients. And some herbs, they play a very vital role, even CKD stage 4 and stage 5. Now, there were a lot of patents taken by US on turmeric, which India ruled out. India said that this particular knowledge is available more than 3,000 and 2,000 years back, and this is a prior art, and prior art cannot be patented. So as per the Intellectual Property Act, India won the case, and with that, then what happened is, after India won the case, you can read it, people started claiming that turmeric is useless. Curcumin is the main thing which is behind every disease, every disorder. Now here you look the statistics. This is the report of 21 established labs in the world, turmeric. Now you see, turmeric has got 517% RDA of iron. That means what? In India, 20% maternal deaths are because of anemia. 46% deaths are because of anemia. And turmeric alone has got 517% of RDA of iron. You see, it is such a reservoir of iron. Not only iron, it has got magnesium, it has got manganese, it has got zinc, various minerals. So when we extract turmeric, curcumin out of turmeric, it is only 2%. In turmeric, curcumin content is 2%. 98% are all these nutrients which are missing in curcumin. So it is wholesomeness, what nature offers to us is awesome. I always say wholesomeness is awesome. Now there are a lot of issues like gluten. Some people say wheat is bad. Now when you see medicinal properties of wheat as a wholesome, wheat germ oil treats cancer, wheat germ oil treats breast cancer basically. Now wheat has endosperm, bran and germ. Now bran has got fiber. Now bran percentage is so high that it treats various types of irritable bowel syndrome and as well as constipation and fiber is useful for lowering LDL cholesterol and boosting HDL cholesterol. So when you take wheat as a whole, it has got a nutritional properties. Now gluten, as far as gluten is concerned, less than 1% population of the world or India also is gluten intolerance. So remaining 99% population do not have any problem. So these are all the hypes that are going on in social media. Another one is lactose intolerance. Lactose intolerance of milk is less than 0.6%. So your 99.4% population do not have lactose intolerance. And milk is the main source of nutrient for even children, for elderly, and basically now there are a lot of issues of milk adulteration. Of course, that is another subject where I may require a full day to talk about milk adulteration. By 2025, WHO says that if milk adulteration continues the way it is going on in India, 67% milk is adulterated, 2025, 87% population would be facing cancer. And this is published by FSSAI, this is published by WHO. So this is a serious issue of adulteration. Milk is not bad, but adulteration of milk, like detergents and some other stupid things which are going on in milk, they are really killing the world, killing the population, and misleading the consumers who are absolutely innocent. These are the curcumin benefits which are listed, published, and scientifically established. It doesn't leave any particular disease, any particular disorder. Like we said, depression, anxiety, neurodegeneration, Alzheimer's, Parkinson's, chronic heart failure, cardiomyopathy, myocardial infarction. I am into treatment as well. I have treated more than 150 cancer patients. I am proud to say that. And these patients, they come when all the ailments have been tried, and medical doctors, they say that there is no treatment for you, go home and relax and wait for your time. Because people would go to the therapies like chemotherapy, radiation, and surgeries and cancer drugs and all that, and that is really killing. Now let me tell you about ginger. Now there is one paper published by me. Ginger is 10,000 times chemotherapy effective. There's more than chemotherapy even if you give ginger. I advise all the patients, or not only patients, but all the people to have 10 to 15 gram of ginger and at least 1 gram of vitamin C every day, and that will prevent the cancer. And exactly the same thing about 80 years back, Linus Pauling got a Nobel Prize, 2 Nobel Prize, not a single Nobel Prize on treatment of cancer with vitamin C. And unfortunately, in our medical protocol, neither in WHO nor in FDA, vitamin C protocol is missing. Doctors are not advising vitamin C IV. It has to be given IV to all the cancer patients who are suffering from metastasis or cancer spreading to bones, liver, and various other organs. Vitamin C definitely kills, this is established, kills the cancer antigens which are there drastically, and leaving almost 80% cancer cells are dying. There are a lot of research papers and there are a lot of credentials with me with the patient's reports that what is happening to exactly to your cancer antigens. Because what happens is certain therapies, they kill cancer cells, but they also kill healthy cells. So, that is a dangerous scenario because the immunity of such patients goes down to drastically to such an extent that, these patients, they can't eat food, they have nausea all the time, they have boils in their mouth, and also their fatigue levels are so much that they are almost bedridden, and absolutely they feel nauseatic when they see the food. So first thing, to develop the appetite, they take the proper diet, then they adopt the proper nutrition and proper exercise. These are the things important. Another thing important for cancer is in India, 80% people are vitamin D deficient. There are a lot of posts, you can refer my Facebook, more than 80%. You can check your vitamin D profile. I am sure 80% population of this hall will be vitamin D deficiency. And if, my dear, if your vitamin D is less than 10, it is strong indication of malignant. So cancer is rapidly growing in India because of whatever you can say, pesticide residues, insecticide residues, heavy metal contamination, fish has got mercury. There are n number of reasons we can say milk is adulterated, but check your vitamin D and poisonous metals, serum poisonous metals. These are the two important things which miss the doctor's prescription list of blood tests. And these are very important tests that you must remember. And vitamin C helps in overcoming all the dangers of such poisonous effects. 1 gram vitamin C a day keeps oncologists away. That I can assure. And on that basis, 2 Nobel Prizes were given 80 years back. But still there is no protocol on vitamin C. That is unfortunate scenario in our country. So at the most I can say you can't take vitamin C, then take vitamin C enriched fruits like oranges, mosambi, or cranberries, various avla, gooseberry. Gooseberry has the maximum concentration of vitamin C. I don't know how to talk because there is so much of pressure on me about the timing. So it is all up to you to decide whether I should continue or I should stop. Now these are the micronutrient deficiencies. Already I talked. Iodine deficiency. Lot of patients, now females, they get cysts in the breast, lumps, and when they go to the doctor, they immediately put for mammography. And these particular lumps, 90% of the lumps are because of iodine deficiency, and that in huge number of medical trainings, because I have trained by now 300,000 doctors in India itself, and abroad also I have trained a lot of doctors on medical nutrition, because medical nutrition is not the part of their curriculum. What I feel, Ayurveda and medical nutrition should be the part of medical curriculum as well, which is a very important aspect. Medical allopathy is not only painkiller, antibiotic, and what you can say symptomatic kind of thing. We must adopt this natural science, natural extracts, and their medicinal. And I had the answers of earlier speakers' questions, because I don't recollect her name, but there were artificial preservatives, artificial colors, artificial sweeteners, everything artificial. We have a solution to that. We have only adopted. Research scientists are the most dangerous substance in the world. Scientists can kill the society. Scientists can also bless the society. Scientists are the one who have created such type of poisons like artificial sweeteners. And the same scientists who got the Nobel Prize, but that Nobel Prize went at west, and nobody could realize such type of efforts which they have done for the humanity. So it is all up to us. We are also to be blamed. What we see, we say we are what we are eating. But you know, when you see the label, artificial sweeteners, they are carcinogenic. Go to the Dr. Google. Dr. Google will tell you what is that artificial sweetener all about. Artificial colors, they are carcinogen. Even though concentration is 0.01%, they are carcinogens. Chemical preservatives, somebody said in the presentation, less than 1%. 1% can kill 1 million population. So, you know, these type of artificial things, everywhere artificial, perfumes are artificial. Why you want to smell like rose? You are not a rose. So what is the logic behind peaches and apricot? Are they real? No. My dear, 18% of the cancer cases are skin cancers. Let me tell you, they are irreversible. You cannot cure. Like yesterday in panel discussion, those who have not attended, these disorders can never be cured. So if somebody is saying, I'm curing cancer, I'm treating diabetes, they are the foolish ones. Nobody can treat, nobody can cure. You can only manage. Whatever your blood sugar levels, blood pressure levels, or blood cholesterol levels, Rahu, Ketu, and Shani, you have to manage all the while, and by diet, nutrition, and of course exercise. And there was one point, why do we do yoga? Because nature is such a reservoir of nutrients. 21% of air is oxygen. 78% is nitrogen and 1% is hydrogen. So when we breathe in, you breathe in oxygen, which is donated to us by plants. And we cut the plants and do the towers, big towers and buildings. So from where we will get oxygen in future? We may have to buy oxygen. That will be the most expensive thing to live for every second. So our expenses, like our ration list, or what we say grocery list or medicine list, there will be added factor that oxygen. Every second I will require 1,000 rupees. or 2,000 rupees or 3,000 rupees. Can you imagine that? What kind of pollution is going on? Environment. Somebody also presented on environment. So these are the critical issues. And yoga, we try to extract that oxygen, whatever there in the nature, in the reservoir, and what we give to the nature is carbon dioxide. Who will convert carbon dioxide to oxygen back? These plants only. I think I am teaching primary, 4th standard. And we all forgotten this. There are huge towers we see. Wherever they go, they cut the plants, towers. And artificial gardens. What is the use of all these artificial things? Now, these are the statistics. Of course, somebody is interested in the presentation, they can also approach the organizers and take the statistics, whatever is mentioned. Because of the time constraint, I may not be able to, but I can say anemia contributes 20% of all maternal deaths. And these are all latest, my dear friends. I get latest updates from the global statistics and also JECFA, that is Joint Executive Subcommittee of Food Safety and Toxicity, as well as WHO, UNICEF, and UNESCO. They are, of course, the leading health guiders, and USDA, what you say. I say United States Depression and Anxiety, DA. So it is the most depressed and anxious body that say whichever is good, not really scientifically, what you can say, proven. What scientific proving you want? When the natural things, according to my definition, there is only one natural thing in the world, breast milk, that infant gets. Nothing else than that. Even water is not natural today. Lot of people are demineralizing and calling it as mineral water. The mineral content in the mineral water is less than the tap water. When you test the mineral content, it is much lesser than, even less than 100, which is a very serious situation. So neither we are drinking pure water, nor we are breathing pure air, nor we are eating pure vegetables and fruits, but we do pure yoga. So there is one hope for all of us. Of course, iodine I have covered. Now this is your favorite USDA, depression and anxiety. So, they say glycemic index and glycemic load. There are a lot of lectures on that, glycemic index and glycemic load, but I don't care glycemic index and glycemic load. I care insulin index. Because after all, that insulin is responsible for healthy metabolism of glucose. And if any carbohydrate can give guarantee of 0 insulin index, which I have developed. Of course, there was some restriction of talking about personal research or personal products, but the product is as sweet as sugar, no artificial sweetener, no sugar. It is basically derived from plant, named as N-sugar, which has got 0 insulin index, which can be given to juvenile diabetes, also given to gestational diabetes during pregnancy, also given to type 2 diabetes, and my dear friends, type 3 diabetes is known as Alzheimer's today. That is type 3 diabetes universally, all neuropsychiatric councils have termed Alzheimer's as type 3 diabetes, and which is formed because of amyloid plaques, which is blocking the neurotransmission to the brain. And another deadly disease is, not disease, of course, is disorder, Parkinson's. You lose your identity on this earth, literally. You can't walk, you can't speak, you can't talk, you don't remember what is happening, your whole body is shaking, there's a motion disorder, and very important point that you have noted is ketogenic diet. Now let me tell you, ketogenic diet, the best ketogenic food is coconut oil. Coconut oil based MCT, that is medium chain triglycerides, medium chain fatty acids, has lauric acid more than 60%, whereas lauric acid content in breast milk is only 3%. And MCT is approved by WHO right from 1-day-old infant to 99 years or 100 years old adult. 1-day-old infant, if he is LBW, that is not in cricket LBW, low birth weight infant. And also those who are chronic, facing chronic illness due to various viral, they are benefited by MCT, medium chain fatty acids. MCT is also benefited during lactation. It increases breast milk secretion, and also it enhances the immunity of newborn, and also it helps in the brain development. Now, Alzheimer's and Parkinson's, if you ask, the best medicine on this earth is MCT coconut oil, which I have extracted. I have 100% pure MCT coconut oil, which I give with guaranteed results to Alzheimer's and Parkinson's. Because these type of patients, Alzheimer's is totally cognition. They forget who is your son, who is your wife, where is your bedroom, where is your, even if they go down to the society, they don't know where they live. So Alzheimer's is totally memory loss, and Parkinson is a motion disorder. They become totally dependent. And Alzheimer's and Parkinson's, the best medicine on this earth is MCT, which is medium chain triglycerides, and which develops ketosis. Now let me tell you quickly what ketosis is the one, and ketoacidosis is the opposite side of that. Most of the herbal extracts or preparations, they develop diabetic ketoacidosis, that is called as DKA. So it is very important when you develop the product, you have to neutralize the extracts and also develop the alkalinity, maintain the alkalinity of extracts, so that the patients don't suffer diabetic ketoacidosis. Now, ketoacidosis means instant renal failure. That goes to the renal failure. It boosts the creatinine. Creatinine, which is expected to be 1.4, it goes beyond 7 and 8 because of diabetic ketoacidosis. The most dangerous condition, and it leads to kidney damage, and it is also irreversible disease. Kidney damage is the most threatening condition because there is no other alternative than hemodialysis, or you have to go for kidney transplantation. So all these things are very important. Then one has to take proper care of diet. Proteins, don't go by artificial proteins and protein concentrates or isolates which are selling in the market, and plus they put artificial colors, flavors, sweeteners in the proteins, and most of the proteins, they are, you can see the pack, you know, like they add creatinine. It will be a dangerous thing that creatinine really increases your kidney, it damages the kidney. So, you know, these are the things. Now, fast forward, madam. What shall I do? Two slides?
I'd love you to speak all day, honestly, but I think about 2 minutes.
Yeah, the enzymes. This is nice pomegranate. This is nice jackfruit. This is nice guduchi. Then this is nice moringa. Then this is nice K27, vitamin D. I will add here. See, what happens is most of the patients are vitamin D deficient. Now, vitamin D, you must have seen a lot of supplements with vitamin D, 60,000 IU or 1 lakh IU injections and all that thing. Vitamin D cannot get absorbed without vitamin K27. K27, that is most important and crucial for metabolizing vitamin D or bioabsorption of vitamin D to help calcium to move to the bones. Otherwise, calcium will be stuck in your arteries, breasts, and various other places other than bones. And that will lead to calcification of arteries, heart failures, cardiac arrest. There is a difference between cardiac arrest and heart attack. Cardiac arrest means there is no supply of blood. All the arteries are clogged, there is no supply of blood, sudden stop of blood, supply of blood, that leads to cardiac arrest, and that leads to the serious condition like coma and death. But heart attacks, they are basically because of improper or inadequate supply of blood. So there is a correction possible in this type of coronary artery diseases, or you can say cardiomyopathy or myocardial infarction, which comes without any symptoms. There are nutraceuticals which can be helpful for anybody, and that have developed a lot of such products. Suppose you are driving a car in a traffic and you get a massive chest pain, what you should do? And hospital, you can see 2 kilometers, but to go to to cross that distance, you might take 45 minutes or 50 minutes, and that much time your heart may not give it to you. So this type of emergency situations, I train cardiologists. There are a lot of cardiologists are trained under my expert guidance on nutrition, and these are being practiced in various hospitals, chronic hospitals, and they really help people. If you keep a knowledge of such things, that will be good. So nutraceuticals don't keep it in mind that they are only preventive. They are life-saving, and they are used in chronic operations. Like chronic heart failure, coenzyme Q10, astaxanthin, they are now going as a therapeutic nutrition. So these are very important keynotes. Now, biomarkers, omega-3, of course, he has covered. And these were the beautiful herbs that you can put it in your diet. Of course, then I think then last one is, okay. This one slide you can see. Now, this slide is the Global Health Associations, wherein I represent a lot of articles, my lot of credentials they have recognized, and few of them have become a medical protocols also for pharmaceutical industry, nutraceutical industry, and herbal healthcare. And these regulatory, they are ready to listen to the scientist's voice. And also it is important that we must listen consumer voice also. That is why my designation is industry's voice of nutraceuticals. So that is where these associations will help. They are always ready to help, provided we go with them with a genuine research and genuine what you can say, approval of claims. Not all clinical trials are good. Some trials are manipulated, and you can see a lot of drugs which are promoted today, which are clinically approved, but doesn't work at all. And in fact, they do more harm than good. With this note, I think I wish you all the best, all the good luck, and also best of your health, wealth, and prosperity. Thank you very much.